We have a very interesting choice of keynote speaker this year, Jenna Thayer. Dr. Mikovits, please tell us more.
Well, interestingly, and this is really a highlight, and this is such an important aspect of this year's meeting, which in fact we've never had in the past, because Jenna is the founder and the director of the Ad Hoc Committee for Health Equity. And she's in fact written the ICD, diagnostic codes. It's called the ICD-11 codes for borreliosis. Borrelia is the pathogen in chronic Lyme disease, and there are several pathogens, but the central pathogen in tick-borne illnesses is in fact borreliosis. And we now know this, and we've known it for at least a decade, to be really a worldwide pandemic, but politically, just as we were in the 80s with HIV and the acquired immune deficiencies that resulted from that infection, we've really just neglected the neuropsychiatric, the neurological, the neuroinflammation, politically as just behavior issues or genetic issues, and we failed to recognize them politically. So Jenna has 32 years of experience in policy, with a former senior advisor to the United States government and the United Nations. So she as a keynote can bring to the practitioners what we haven't been able to do in the full decade that I've been involved, and that is have the government understand this isn't that this simply isn't a political football, that these are lives and these are patients who have an infections and the dysregulation of their immune systems at the heart of these what appear to be simply psychiatric diseases. So we now know there really is no psychiatric disease that doesn't have at the heart a dysregulation, some dysfunction of immunity or a pathogen or an environmental toxin involved. And in fact, it's our government's responsibility to recognize this, and simply, so now this patient population, which for decades has been neglected and been denied appropriate treatment for their acquired infections, can actually have a strong voice in policy, can be made to bring every aspect of medicine, including insurance and drugs developed for other acquired immune deficiencies, to the treatment strategies and diagnostic strategies. And that's where this is so important, and has been lacking, because the fabulous scientists and physicians that are speaking at this meeting, as in years past, really can't make progress until policy is changed. And that's where Jenna Thayer will be a fabulous addition, and I can't wait to hear this aspect of the conference.